A 30-year-old male had an OPG, and multiple well-defined unilocular and multilocular lytic lesions were visible. These lesions involved the body and angle of the mandible, and were associated with unerected molars. What is the most likely diagnosis? A dentigerous cyst B osteomyelitis C. Gorlins disease D. Fibrous dysplasia E. Metastatic disease 2 and OPG was performed on a 15-year-old following an alleged assault. The plain film revealed generalized expansion of the mandible with a ground glass appearance to the bone, and multiple multiloculated cystic lesions affecting both bodies of the mandible. What is the likely diagnosis? One answer C. Gorlins disease. The description is very typical of a dentigerous cyst. They are cysts associated with the crown of an unerected cyst and affect the molars and canine teeth. Gorlin syndrome is associated with multiple dentigerous cysts, multiple basal cell nevi, rib abnormalities, and heavy calcification of the falx cerebri. It is an autosomal dominant condition. 2 answer B. Cherubism. Cherubism is also known as familial fibrous dysplasia and is seen in children but is more severe in boys. Fibrous dysplasia is characterized by generalized bone expansion and ground glass changes. Multicystic lesions are common in fibrous dysplasia. Children with cherubism have problems with their dentition, but it usually regresses in adolescence. 3 answer C. Generalized tram track enhancement. This patient has an optic nerve sheath meningioma. These typically demonstrate uniform bright enhancement with a non-enhancing optic nerve. E. Hyperparathyroidism 3A55-year-old female was admitted with a worsening headache. On imaging, the right optic nerve appeared thickened with linear plaque-like calcification and optic canal hyperostosis. What pattern of enhancement is most likely? Apache enhancement of the optic canal. B. No enhancement. C. Generalized tram track enhancement. D. Peripheral enhancement. E. Avid enhancement with flow voids. For a 67-year-old woman was admitted. Nerve. Patchy enhancement of the optic nerve is seen in optic nerve gliomas. For answer C. Admitted with right-sided diplopia and proptoses. She was known to have metastatic breast cancer and was on Herceptin. On CT, there was gross bony destruction of the right greater wing of sphenoid with soft tissue filling the superior orbital fissure. The inferior orbital fissure and optic canal were not affected. What nerves may be affected? A 3, 4, 6, V2 and 6 V2, 3, 4, V1, V2 and 6 C3, 4, 4, 6 and 6 D3, 4, V1, V2 and 6 E3, 6, V2 and 6 5 A45, year. C3, 4, V1 and 6 the oculomotor 3, trochlear 4, ophthalmic branch of the trigeminal nerve 6, and abducens 6, and sympathetic filaments of the internal carotid plexus all pass through the superior orbital fissure. The superior and inferior ophthalmic veins, the meningeal branch of the lacrimal artery, and the orbital branch of the middle meningeal artery also pass through the superior orbital fissure. Year-old woman with known multiple sclerosis complained to her GP that she had visual loss. On examination, she was found to have upper right-sided quadrantanopia. Where is she likely to have a new plaque? A right optic nerve, the optic chiasm, C. Chiasm C, left lateral geniculate nucleus, D, right optic tracts, E, left optic radiation 6, A, 5-year-old boy. Six, and sympathetic filaments of the internal carotid plexus all pass through the superior orbital fissure. The superior and inferior ophthalmic veins, the meningeal branch of the lacrimal artery, and the orbital branch of the middle meningeal artery also pass through the superior orbital fissure. 5. Answer E. Left optic radiation monocular visual loss is due to a defect in the optic nerve. Bitemporal hemianopia is due to a defect at the optic chiasm level. Right-sided homonymous hemianopia is caused by a defect in the contralateral optic tract or through any part of the contralateral optic radiation. Radiation. Right upper outer quadrantanopia is due to a defect in part of the optic radiation. Radiation. Central bilateral homonymous hemianopia is due to a defect in the contralateral primary visual cortex. 6. A 5-year-old boy was noted by his parent to be bumping into things on his left. On examination, he was found to have a soft tissue mass affecting his left retina. On CT, there was a poorly enhancing mass causing irregularity of the orbit and surrounding conal fat haziness. This mass was most likely to be a secondary from which tumor. A neuroblastoma B. Wilms C. sarcoma. Cortex. 6. Answer A. Neuroblastoma. The most common orbital metastases in children are from neuroblastomas followed by Ewing's tumors and leukemia. In adults, breast and lung are the most common primaries causing intraorbital lesions. The deposits are typically intraocular. 7. Answer D. Right carotid artery. 7-8-25-year-old male was admitted with a painful partial right Homer syndrome. A contrast CT was performed. In which area of the scan would you expect to find the pathology? A right intraconal region, B left artery. A painful partial right-sided Horner syndrome is due to a disruption of the sympathetic nerves within the wall of the ipsilateral carotid artery caused by dissection. E left carotid artery. 8-54-year-old underwent a CT of the paranasal sinuses for functional endoscopic sinus surgery, FES, planning. The right frontal sinus appeared significantly larger than the left and was opaque. At the base there was a dense lesion, which appeared to contain compact cortical bone and protruded into the sinus cavity. On MRI the lesion appeared as a signal void. What is the most likely diagnosis? Answer A. Ivory Osteoma. Ivory osteomas are benign hamartomas of the bone, which are relatively common. They may be associated with other conditions such as Gardner's syndrome. They most commonly occur in the frontal and ethmoid sinuses and may cause obstruction of the sinus ostium. Ivory osteomas are dense areas of compact bone and are well-defined sclerotic bone on CT and low signal on T1 weighted imaging. Foreign body. 9. A newborn baby boy developed respiratory distress post-delivery. Foreign body. 9. A newborn baby boy developed respiratory distress post-delivery. He was intubated and did well, but as soon as he was extubated he again developed respiratory distress. CT demonstrated bilateral air/fluid levels within the nasal cavities and narrowing of the posterior coni with bowing of the posterior maxilla. What is the most likely diagnosis? Imaging. 9. Answer E. Bilateral choanal atresia. Choanal atresia is failure of perforation of the oronasal membrane. Bilateral choanal atresia is a pediatric emergency because babies are obligate nasal breathers until 2 to 6 months. The septation is either bony, 85%, or membranous, 15%. The bilateral form is slightly more common. It is associated with other congenital anomalies such as malrotation, DeGeorge syndrome, and fetal alcohol syndrome. With bilateral disease, babies are intubated and endoscopic perforation is performed. 10. Answer A. Glomus tympanicum. Glomus. Bilateral choanal atresia. 10. A 37-year-old woman was being investigated for pulsatile tinnitus and was found on otoscopy to have a blue mass deep to the tympanic membrane. On CT, there was a small left-sided soft tissue mass abutting the left cochlear promontory. This enhanced brightly with contrast. What is the most likely diagnosis? A glomus tympanicum. B. Glomus Glomerus tumors are rare tumors arising from the paraganglionic tissue and can occur anywhere between the skull base and pelvis. Glomus tympanicum tumors present with pulsatile tinnitus and hearing loss and are seen on otoscopy as a reddish blue mass behind the tympanic membrane. They are typically sited along the lateral aspect of the cochlear, particularly the cochlear promontory. The globus tympanicum does not erode the ossicles but engulfs them. A carotid artery aneurysm 11A patient is due to have an operation on their parotid gland, and the end surgeon is concerned he cannot identify the facial nerve on the patient's pre-op CT or MRI scans. Which structure that lies medial to the nerve can be used as a landmark? A facial artery. The parotid gland is divided into superficial and deep lobes by the facial nerve. As the portion of the nerve which traverses the gland is not readily seen on routine imaging, the retromandibular vein, which lies just medial to the nerve, can be used as an anatomical landmark. The external carotid artery is also present within the parotid gland and gives off its terminal branches, maxillary and superficial temporal arteries within the gland parenchyma. Heal despite a prolonged course of broad-spectrum antibiotic therapy. Prior to biopsy, imaging was performed. An MRI scan confirmed a cystic lesion, which was of heterogeneous increased signal on T1W and T2 imaging. The density of the lesion on CT was that of fat. What is the most likely? 12. Answer B. Dermoid cyst. Dermoid cysts usually occur along the midline and are commonly found at this location. They are thought to occur within the region where the neural tube closes. A nasal dermoid cyst can be associated with a deep sinus with potential communication with the intracranial cavity. Dermoid cysts contain skin and sebaceous material. 13. A 33-year-old male presented with a history of gradually worsening unilateral nasal obstruction and epistaxis. Endoscopy revealed a polypoidal mass filling the left nasal cavity. CT scan showed a soft tissue mass arising from the lateral nasal wall with associated bone destruction of the medial wall of the maxillary sinus and heterogeneous enhancement post-administration of contrast. An MRI scan confirmed intermediate signal intensity on both TI and T2W images with avid enhancement post-administration of gadolinium. What is the most likely diagnosis? Answer B. Inverted papilloma. Inverted papillomas arise from the lateral nasal wall and appear macroscopically similar to nasal polyps, but with frond-like projections. The underlying respiratory epithelium exhibits an endophytic growth pattern. Even though these are benign lesions, there is a possibility of focal malignant transformation, and therefore regular surveillance is usually undertaken. The avid enhancement post-contrast differentiates an inverted papilloma from a mucocele. Nasal polyps, mucoceles, or mucus retention cysts would not be expected to exhibit bony destruction. A nasal polyp 14. A 40-year-old man who presented with progressive right-sided facial pain and paresthesia underwent a CT scan. This revealed a bibbed mass arising from Meckel's cave, and ultimately a trigeminal nerve schwannoma was diagnosed. What signal characteristics would be most characteristic on MRI? 14. Answer E. Isointense to gray matter on T1 weighted images. A trigeminal nerve schwannoma displays the characteristic imaging appearances that are common to all schwannomas. On CT imaging, they are isointense with brain parenchyma, exhibiting enhancement post-contrast and containing cystic components. On MRI imaging, the lesion is likely to be isointense with brain parenchyma on T1, hyperintense on T2, weighted images, and shows enhancement post-gadolinium. E. Isointense to gray matter on T1, weighted images 15. A patient presents with acute onset headache, right-sided otoroe, and associated abducent nerve palsy. CT revealed opacification of the petrous apex on the symptomatic side and cavernous sinus enhancement. On MRI, there was a low signal mass within the petrous apex, which demonstrated bright peripheral enhancement with contrast. The mass was hyperintense on T2W. What syndrome is this patient suffering from? A. Grade-Negos syndrome, B. Korsakoff syndrome, C. Colatides syndrome, D. Riley-Day syndrome, E. Gerstmann syndrome. Gadolinium. 15. Answer A. Grade-Negos syndrome. This patient has developed an abscess in the aerated petrous apex, which typically spreads from the middle ear. The infected phlegm irritates the fifth and sixth nerves as they pass the petrous apex, causing the triad of symptoms called Grade-Negos syndrome, otitis media, retroorbital pain, and a sixth nerve palsy. Typically, infective agents are Pseudomonas and Enterococcus. The petrous apex is aerated in approximately 30% of the population. Korsakoff syndrome is typically seen in alcoholics with thiamine deficiencies that have an inability to produce new memories and confabulate. Riley-Day syndrome is an inherited condition resulting in dysautonomia. Gerstmann syndrome is characterized by four primary symptoms of dysgraphia, dyscalculia, finger agnosia, and left-to-right disorientation. Chilaiditides syndrome describes interposition of the colon between the liver and the diaphragm. 16A16, year, old male presented with epistaxis following contact sports. CT revealed a large mass in the nasopharynx extending into the pterygopalatine and infratemporal fossa. Following contrast, there was significant enhancement and erosion of the medial pterygoid plate was seen. What treatment would be an appropriate next step in his management? A conservative management. B. Medical management. C. Embolization. D. Direct intratumoral alcohol injection. E. Surgical excision. 17. A 7-year. Diaphragm. 16. Answer C. Embolization. Given the presentation and radiological features, the mass is most likely to be a juvenile angiofibroma. These tumors typically arise from the region of the sphenopalatine foramen and extend into the pterygopalatine and infratemporal fossa. On CT, there is characteristic erosion of the medial pterygoid plate, which is a useful distinguishing feature between juvenile angiofibromas and other nasopharyngeal mass lesions. Angiography is not necessary for diagnostic purposes, but may be carried out prior to preoperative embolization. Therapeutic embolization is an adjunct to surgery, as the whole supply to the tumor cannot generally be embolized. Seven-year-old presented with a midline neck swelling following a respiratory tract infection. On examination, this moved with swallowing, and an ultrasound revealed a hypoechoic nonvascular lesion. MRI confirmed an infrahyoid location and demonstrated a high signal on T2. What percentage of these lesions is likely to undergo malignant change? A. 1%, B. 2%, C. 7%, D. 12%. 17. Answer A. 1%. Thyroglossal cysts occur along the path of migration of the fetal thyroid from its position at the base of the tongue to its adult position in the mid-neck. The majority of these occur in the midline and in an infrahyoid location. Less than 1% undergoes malignant change. Thyroglossal duct carcinoma has a slight female predilection, and histologic findings of thyroglossal duct carcinoma are most commonly papillary carcinoma, 75 to 80%. 18 and 18, year, old man presents to the maxillofacial team suffering from a blow to the mid-maxillary region. Examination findings included marked facial edema, bilateral subconjunctival hemorrhages, and epistaxis. Plain facial views reveal a fracture segment that has a pyramidal shape and extends from the nasal bridge below the nasofrontal suture through the frontal processes of the maxilla, infralaterally through the lacrimal bones and inferior orbital floor and into the orbital foramen. Inferiorly, the fracture extended through the anterior wall of the maxillary sinus. The zygoma and pterygoid plates were both fractured. What type of fracture is this? L. 2021, 8 1547 to 50. 18. Answer B. LE42 fracture. All LE4 fractures involve the pterygoid process. LE4I is a transverse fracture through the maxilla. LE42 is more extensive and the separated fragment is pyramidal, while in LE43 there is complete craniofacial disjunction. In practice, fractures do not fit these descriptions exactly and may be asymmetrical or coexist. The classification is still in general use and aids in subsequent surgical management. In LE4I and 2 the fractured maxillary fragment is usually wired to the zygomatic arches, but if these are fractured as in LE43, a more complex pin and rod fixation to the skull vault is undertaken. E. tripod fracture 19A30, year, old man presents with bilateral external ear masses. Otoscopic examination. Examination reveals these lesions to be a buildup of layers of flaky skin. Further history elucidates chronic sinusitis and bronchiectasis. What is the most likely diagnosis? The skull vault is undertaken. 19 Answer A. Keratosis Audrans. Keratosis Audrans is a bilateral process of inflammatory ear masses in association with chronic sinusitis and bronchiectasis. Van der Hoef syndrome is characterized by osteogenesis imperfecta and osteosclerosis. Malignant otitis externa, Cephal's ear and cholesteatoma could all account for inflammatory external ear masses, but have no other clinical associations. 20 Answer A. Sinus hypoplasia. All the conditions can cause opacification of the maxillary sinus. 2810-year-old girl presented with a unilateral enlarged orbit. Facial X-rays revealed opacification of the maxillary sinus with no air/fluid level. CT demonstrated depression of the right orbital floor with enlargement of the orbit and lateral displacement of the lateral wall of the nasal fossa. The middle turbinate was large but morphologically normal. What is the most likely diagnosis? A sinus hypoplasia B maxillary dentigerous cyst C primordial dentigerous cyst D acute sinusitis E ameloblastoma 21 The report. Sinus hypoplasia is the most likely answer given the CT features. Maxillary dentigerous cyst contains a tooth or crown whereas primordial dentigerous cyst does not. In acute sinusitis one would expect an air/fluid level in radiological investigations representing the disease process. Classical CT findings of ameloblastoma are of multilocular lesion with scalloped borders on a background of diffuse ground glass changes within the bone. 21 Answer A. Croup. Report on a child's neck X-ray reads, there is loss of the normal subglottic angle resulting in a wine bottle-shaped appearance on AP projection. On the lateral film there is an ill-defined haziness of the soft tissue/air interface between the glottic and subglottic regions. What is the most likely diagnosis? A croup B supraglottitis C congenital tracheal stenosis D subglottic hemangioma E laryngomalacia. These are the classical XR findings in croup. In supraglottitis one would expect to see the thumb sign of a short, broad epiglottis. Plain films in congenital tracheal stenosis would reveal a narrowed tracheal lumen. In subglottic hemangioma, indicative findings are a soft tissue mass in the subglottic region extending inferiorly, narrowing the airway. Laryngomalacia is a clinical and endoscopic diagnosis, but findings consistent with laryngomalacia are anterior bowing and inferior displacement of the area epiglottic folds. Films taken during expiration would show abnormal persistent dilatation of the oropharyngeal airway, which is indicative of laryngomalacia. 22 Answer C. 50%. You are considering the utility of CT in detecting acoustic neuromas, and read a study evaluating its use in 200 people of whom 10 actually had the condition. The study reports that CT was reported as abnormal in 7 patients, and there were 188 true negatives. What is the sensitivity of CT for detection of acoustic neuroma in this study? A 2 point of the area epiglottic folds. Films taken during expiration would show abnormal persistent dilatation of the oropharyngeal airway, which is indicative of laryngomalacia. 22 Answer C. 50%. Sensitivity is a measure of how well the test picks up the disease if it is present, that is, true positive/true positive. Positives and false negatives. Specificity is a measure of how often the test is negative when the disease is not present, that is, true negatives/true negatives and false positives. E99% 23. This question relates to the descent of the thyroid gland during development. At which of the following anatomical sites are you least likely to find maldescended thyroid tissue? A. Within foramen lacerum. B. Within foramen C. 23. Answer A. Within foramen lacerum. Answer A is incorrect, as all the other answers are on the normal course of thyroid descent from the back of the tongue, foramen cecum, inferiorly to its normal position in the neck. Foramen lacerum transmits the internal carotid artery. 24. Cecum C anterior to the thyroid cartilage. D. Within the hyoid bone. E anterior to the hyoid bone. 24. A 4-year-old girl, who weighs 16 kilograms, presented in status epilepticus, and a lesion was visible in her posterior fossa on an unenhanced CT scan. A post-contrast scan is being planned for further assessment. How much 300 mg/m lyohexol non-ionic contrast would be appropriate? A 4 milliliters. B. 8. Answer D. 32 milliliters. The appropriate dose is 2 ml/kg up to an adult dose of 50 milliliters. Usually, a hand injection is sufficient and the patient is imaged within the next few minutes. It is possible to estimate a child's weight between 1 year and 10 years by the formula weight equals age plus 4 x 2. E 48 milliliters. 25. A 9-year-old boy underwent an MRI while being investigated for cognitive difficulties. Prominent occipital horns and a high-riding third ventricle were seen. Sagittal sections revealed a radial orientation of the gyri. What is the most likely diagnosis? A Joubert syndrome. B. Septo-optic dysplasia. C. Corpus callosum. A genesis. D. Holoprosencephaly. E. Poencephaly. 26. A 6-month-old male baby underwent neurological workup between 1 year and 10 years by the formula weight equals age plus 4 x 2. 25. Answer C. Corpus callosum agenesis. Agenesis of the corpus callosum can be partial or complete. The rostrum and splenium are absent or hypoplastic in the partial variety. Widely separated lateral ventricles, with longitudinal white matter motor tracts, probes bundles, indenting the medial margins of the lateral ventricles, and dilated occipital horns, Pacephaly, are seen. Associated abnormalities include Chiari-2, Dandy-Walker malformation, migration disorders, and lipomas. A 6-month-old male baby underwent neurological workup. An MRI showed a wide CSF communication between the left lateral ventricle and the cortical subarachnoid space. A similar smaller communication was seen on the right, without pouching along the lateral border of the right lateral ventricle. What is the most likely diagnosis? A schizencephaly. B. Hydranencephaly. C. Megalencephaly. D. Lobar motor tracts, probes bundles, indenting the medial margins of the lateral ventricles, and dilated occipital horns, Pacephaly, are seen. Associated abnormalities include Chiari-2, Dandy-Walker malformation, migration disorders, and lipomas. 26. Answer A. Schizencephaly. Schizencephaly describes a full-thickness CSF cleft lined by gray matter extending from the subarachnoid space to the subependema of the lateral ventricle. This can be either open-lipped, the walls of the cleft are separated, or closed-lipped, the walls are opposed. The clefts may be unilateral or bilateral and asymmetric. The important differential is porencephalic cyst, which results from insult to a normally developed brain. 27. Answer C. Ivory 27. A 5-year-old with seizures and cognitive impairment had an MRI scan. This revealed features highly suggestive of heterotopia. What are the likely findings on the MRI? A CSF-lined cleft extending from the ependymal surface to cortical pia. B. Shallow sylvian fissures, and adgyroid cortex. C. Bilateral nodular subependymal gray matter. D. Squared bilateral nodular subependymal gray matter. Heterotopic gray matter occurs secondary to developmental arrest of migrating neuroblasts from the ventricular walls to the surface of the brain. Nodular and laminar forms are described. Signal is isointense to gray matter on all sequences. 28. Answer A. Poor brain sulcation with intraparenchymal calcification. 28. A 6-year-old female was investigated for a neurogenic bladder and persistent leg pain. Clinical examination revealed a hairy patch overlying the lumbosacral region. An MRI showed a bony cleft within the spinal canal and two hemichords from TI to LL. What is the most likely diagnosis? A diastematomyelia. B. Cyanomelia. C. Myelocystocele. D. Dorsal enteric. Diastematomyelia. Diastematomyelia is characterized by developmental sagittal cleft which splits the spinal cord or filum terminale. The septum is either bony, osteocartilaginous, or fibrous. This usually occurs between T9 and SI and has a distinct female preponderance. It is associated with other anomalies including Chiari-2, tethered cord, neuroenteric cyst, and dermoids. Syringohydromyelia. 29. A healthcare worker noted that a 3-month-old child had an unusual shaped head. She was seen by the pediatrician who requested a CT head. This demonstrated bony fusion of the sagittal suture. The metopic and coronal sutures were open. What is the most likely diagnosis? Dermoids. 29. Answer E. Scaphocephaly. Craniostenosis is the premature closure of sutures. At birth, all sutures are normally open. Typically, only one suture is fused, but in a quarter of cases more than one fuses. Early fusion results in an abnormally shaped head. Boys are more commonly affected, and it may be part of a syndrome. Scaphocephaly is the premature fusion of the sagittal suture, is the most common, and leads to a long thin head. Brachiocephaly is premature fusion of the lambdoid or cornal suture producing a short wide head. Plagiocephaly is unilateral fusion of the cornal and lambdoid suture producing a lopsided skull. Trigonocele is the fusion of the metopic suture producing a forward-pointing skull. A cloverleaf skull typically occurs in thanatophoric dysplasia and is due to premature closure of the sagittal, cornal, and lambdoid suture. 30 Answer C. Transphenoidal encephalocele. This patient has a transphenoidal or basal encephalocele. Basal encephaloceles account for 10% of all encephaloceles. Diagnosis. A brachycephaly B cloverleaf skull C plagiocephaly D trigonocephaly E scaphocephaly 30 a 5-month-old child was being investigated for a nasopharyngeal mass. He had a cleft palate but otherwise appeared morphologically normal. On CT, there was a bony defect in the roof of the sphenoid sinus, and a soft tissue and CSF density mass extended into the nasopharynx. What is the diagnosis? A mucocele B transphenoidal meningocele C transphenoidal encephalocele D leptomeningeal cyst E dermoid cyst 31A19. They typically present with a soft tissue mass within the nasal cavity, which can increase in size during the Valsalva maneuver. Affected patients may be obligate mouth breathers due to nasal obstruction. It is associated with agenesis of the corpus callosum, pituitary, and hypothalamic dysfunction, and hypoplasia of the optic nerves. 31 Answer D. Dermoid cyst 31A19. Year, old boy was admitted with new onset seizures. On T2, weighted MRI there was high signal within the atrophied left hippocampus. What other feature is likely to be associated with this condition? A. Enlargement of the occipital horn of the lateral ventricle. B. Generalized cerebral atrophy. C. Ipsilateral atrophy of the mammillary body. D. Atrophy of the amygdala. E. Heterotopia 32A76. Hypothalamic dysfunction and hypoplasia of the optic nerves. 31 Answer D. Atrophy of the amygdala. This boy has mesial temporal sclerosis, which is characterized by atrophy of the hippocampus and high signal on T2, weighted MRI. There is also loss of the normal interdigitation of the hippocampal head. It is associated with atrophy of the ipsilateral mammillary bodies and fornix. 32 76. Year, old with scan 14 hours post-onset of left-sided weakness and facial droop. Which of the following would you not expect to find on the CT scan? A hyperdense MCA sign. B. Loss of gray/white matter differentiation. C. Obscuration of the lentiform nucleus. D. Mass effect with midline shift. E. Insular ribbon sign 33 A50. Answer D. Mass effect with a midline shift. CT findings in stroke evolve with time. Although 60% of scans obtained within 12 hours are normal, early signs like a hyperattenuating MCA and obscured lentiform nuclei may be seen. Loss of gray-white matter interface along the lateral insula is termed the insular ribbon sign. Mass effect increases between 24 and 72 hours and is not an early sign. Osborne A.G. Diagnostic Neuroradiology. St. Louis, M.O., Mosby, 1994. Pages 344-7. 33. E. Insular ribbon sign 33A55. Year, old lady, was repeatedly imaged following surgical evacuation of a large right-sided extraaxial bleed sustained in a high-speed RTA. On her latest CT, there was widespread cerebral edema, with effacement of the right suprasellar cistern and medial displacement of the uncus and parahip poca MPUs. Enlargement of the right CP angle cistern was also seen. What territory is she currently at most risk of infarcting? Infarcting. A right ACA territory. B. Right MCA territory. C. Right PCA territory. D. Left MCA territory. 33 Answer C. Right PCA territory. Features described are those of descending transtentorial herniation, where the uncus and parahippocampal gyrus protrude over the free tentorial margin. With progressive herniation, the ipsilateral PCA may become compressed against the tentorial incisure, resulting in occipital ischemia or infarction. Other manifestations of descending transtentorial herniation include periaqueductal necrosis, Durette hemorrhage, and compressive cranial neuropathies. E left PCA territory 34A22, year, old male developed a postcoital headache, and was admitted via the emergency department with a CT, which demonstrated diffuse subarachnoid blood in the suprasellar cistern. CT cerebral angiogram and conventional cerebral catheter angiogram performed 6 weeks after the event were both negative. What is the most likely cause? A. Anterior communicating artery aneurysm, B. Middle cerebral artery aneurysm, C. Carotid dissection, D. Venous bleed, E. Subdural bleed. 34 Answer D. Venous bleed. If there have been 2 negative angiograms, the likely cause of the cerebral bleed is venous in nature. When there has been a single negative angiogram, a repeat angiogram is usually performed after a period of time, as vasospasm in an artery adjacent to an aneurysm may have occurred, leading to a false negative during the first angiogram. 35 Answer B. A45, year, old woman was admitted with a GCS of 12. There was no history available. On CT, there was bilateral parasagittal hemorrhage affecting the posterior frontal lobe and parietal lobes. The lateral ventricles were dilated and the basal cisterns partially effaced. The rest of the brain parenchyma was normal. What is the most likely diagnosis? A. Hydrocephalus, B. Sagittal sinus thrombosis, C. Hypertension. Answer B. Sagittal sinus thrombosis. Sagittal sinus thrombosis can result in venous infarcts. These typically present as bilateral parasagittal hemorrhage affecting both the gray and white matter. The patient also has hydrocephalus as a result of the venous infarct. Hypertensive angiopathy typically produces hemorrhage within the basal ganglia. Amyloid angiopathy results in lobar hemorrhage within the frontal and parietal lobes. The deep gray matter is typically spared. Metastasis occurs within the corticomedullary region. Hemorrhage can occur within them. It would be unlikely that there were 2 metastases that resulted in hemorrhage. 36 Answer D. Moyamoya disease. E. Hemorrhage from metastatic disease 36A10, year, old child of Oriental origin, was being investigated for right-sided hemiplegia. MRI revealed a left MCA territory infarct. Multiple flow voids were seen within the basal ganglia, and the left supraclinoid ICA appeared small in caliber on the MRA. Multiple collaterals were present in the basal cisterns, and the vertebrobasilar circulation appeared normal. What do the intracranial disease? The moya-moya pattern of collateral blood flow is nonspecific, and can be seen in slowly progressive intracranial occlusive vascular disorders such as atherosclerosis, radiation-induced angiopathy, and sickle cell disease. It is classically described in the Japanese. There is occlusion of the supraclinoid ICA with progressive collateralization to supply the ischemic areas. Angiography demonstrates a puff of smoke appearance and multiple flow voids are seen on MRI. 37 Answer C. Anterior inferior cerebellar artery. E. Kawasaki's disease 37A66, year, old presented with symptoms of dizziness, ataxia, and nausea. CT showed a low-density non-enhancing area along the right anterolateral aspect of the cerebellum. The ipsilateral cerebellar vermis and tonsil also appeared involved. A diagnosis of cerebellar infarction was made. What territory is involved? A superior cerebellar. 37 Answer C. Anterior inferior cerebellar artery. The SCAs supply the entire superior surface of the cerebellar hemispheres, vermis, much of the cerebellar white matter, and the dentate nuclei. The AICAs supply the anterolateral surface of the cerebellum, the middle cerebellar peduncles, flocculus, and infralateral pons. The picas supply the postero-inferior surface of the cerebellum, inferior vermis, tonsils, and the posterolateral medulla. A patient has a dual-phase subtraction study for investigation of hyperparathyroidism, and a focus of uptake is seen on the TC99M MIBI scan with a corresponding area of increased uptake on the 1123 study in the region of upper pole of the right lobe of the gland. What is the most likely cause for this finding? A functioning parathyroid adenoma, B. papillary thyroid tumor, C. multinodular goiter with prominent nodule, D. solitary functioning thyroid nodule, E. 38 Answer C. Multinodular goiter with prominent nodule. Multinodular goiter can give rise to heterogeneous uptake in both types of scan as a functioning thyroid nodule will take up both tracers. The presence of smooth uniform uptake on the thyroid scan would have been more consistent with a functioning parathyroid adenoma. Salivary gland uptake is seen with TC99 and protectate but not I131. Thyroid malignancy presence as a cold, non-functioning, nodule in 90% of scans. E submandibular salivary gland 39, A22, year, old male was catapulted from his motorbike. He was admitted unconscious and lateral cervical spine X-ray demonstrated a small triangular fragment of bone anteroinferior to the anterior margin of C4 with widening of the spinous processes at C4, C5. What was likely to have been the mechanism of injury? A vertical compression deflection with rotation C hyperextension D hyperflexion E lateral flexion / shear. 39 Answer D, hyperflexion. Hyperflexion injury of the spine accounts for 46 to 79% of all cervical spine injuries. The anteroinferior teardrop fracture is the most severe and unstable injury of the spine. The widening of the posterior elements indicates disruption of the posterior ligament complex. It is an unstable injury, which results in ligamentous damage and spinal cord compression. Typically, these occur at C6 to C8. Hyperflexion injuries are the most common injury, accounting for between 50 and 75% of injuries. The anterior height of the vertebral body is reduced with anterior reduction in disc space, and there is diffuse prevertebral soft tissue swelling. Extension teardrop fractures occur at the anteroinferior corner of C2, and this may occur in isolation or with a hangman's fracture. Here there is widening of the anterior disc space. 40 Answer C, 3 to E lateral flexion / shearing 40 A 6-month-old child was brought to the emergency department by his parents following a fit. The attending doctor discovered multiple bruises to his chest and pelvis and suspected non-accidental injury. A skeletal survey revealed multiple fractures, and a head CT revealed a subdural hematoma. An MR was performed and demonstrated high signal on TI and low signal on T2. How long is it likely the injury was sustained? Three to 7 days, intracellular methemoglobin. The appearance of blood clot on MRI is dependent on several factors, including the relaxivity and susceptibility effects of the iron-containing hemoglobin. Accurate dating of hematoma is contentious, particularly in the setting of suspected NI, and should only be attempted by experts, although the temporal evolution of hemoglobin degradation products does occur in a predictable fashion. 41 Answer B, acicular dislocation. E greater than 14 days, hemosiderin. 41 Following a high-speed RTA of 45, year, old male had a multi-trauma scan. A fracture was seen running across the right petrous temporal bone extending from the squamous portion laterally to the mesotympanum medially. Opacification of the mastoid air cells was evident. What is the patient most at risk of? A sensorineural deafness via ossicular dislocation. C. Irreversible facial dislocation. The fracture described is a longitudinal fracture of the petrous temporal bone, which runs parallel to the axis of the bone. Ossicular dislocation, most commonly incudostapedial, is usually present. Facial paralysis occurs in 10 to 20% secondary to edema, but resolves spontaneously. Odor OE may be seen. In transverse fractures, which run perpendicular to the axis of the pyramid, there is irreversible sensorineural hearing loss and facial paralysis in 50%. Recurrent mastoiditis 42, a female, is referred from a thyroid clinic with suspected Graves' disease with an elevated T3 and low TSH. She is a tachycardic at 90 bpm, but has a regular pulse and has minor eye symptoms. She is booked for a technetium 99 and protectate scan prior to any therapy. If the diagnosis is correct, what is the scan likely to show? A normal uptake, diffuse avid uptake in a 50%. 42 answer B, diffuse avid uptake in a uniform pattern. Graves' disease usually shows avid uniform uptake. Patchy uptake may indicate Hashimoto's thyroiditis or multiple hot nodules. Radioactive thyroid therapy is contraindicated in poorly controlled thyrotoxicosis as it may precipitate a thyroid storm and can worsen eye symptoms, but a diagnostic scan is appropriate. A 42-year-old woman with a preceding history of flu-like symptoms presented with a day history of increasing confusion followed by 3 generalized seizures. Initial CT revealed no abnormality, while an MRI showed high signal on T2 in the medial right temporal and right insular region. No enhancement with gadolinium and little mass effect were seen. She remained in intensive care, and a repeat MRI a week later showed extensive high signal in the temporal lobes and frontal lobes with multiple low signal foci on T2 GRE. There was no ventricular dilatation. What is the most likely diagnosis? A toxoplasmosis b herpes. Diagnostic scan is appropriate. 43 Answer B. Herpes encephalitis. Herpes simplex encephalitis results in fulminant necrotizing encephalitis and is due to the herpes simplex virus, HSV. A third of patients have a primary infection while the rest are due to reactivation. Patients present with acute confusion and disorientation which can progress to fits, loss of consciousness and death. HSV has a predilection for the temporal lobes, insula, frontal lobes and cingulate gyrus. The putamen is typically spared. On early imaging on FLAIR and T2W there is high signal in these areas. There may be restricted diffusion in the affected areas due to infarction, and lack of restrictive diffusion suggests reversibility. At 10 days the extent of the tissue involved is known, and parenchymal hemorrhage can be seen at this stage. The prognosis is poor with only 2.5% of treated HSV patients returning to a normal life. If untreated there is a 70% mortality. 44 Answer B. Cerebral abscess. Cerebral Icitornegalovirus infection 44A40, year, old man with headaches was assessed with a CT, which showed a thin-walled uniformly enhancing lesion with marked vasogenic edema in the right temporal lobe adjacent to the petrous ridge. On MRI the lesion appeared ISO hypointense on TI and hyperintense on T2, weighted images. Images. On DWI there was high signal and low signal on the ADC. Cerebral abscess. Abscesses typically result in a thin uniformly enhancing rim of contrast while metastasis and GBM have thick walls and incomplete enhancement. The DWI characteristics are of restrictive diffusion, which occur in infarcts and cerebral abscesses, although not all abscesses demonstrate these signal characteristics. Sometimes the abscess may have a thin rim of high signal on TI and low signal on T2, weighted imaging, which is caused by hemorrhage or free radicals. Chronic hematoma 45A38, year, old immunocompromised male presented with increasing headaches and worsening memory. CT showed 3 discrete hyperdense lesions in the corpus callosum and centrum semiovale. Partial enhancement with eccentric necrotic areas was seen. What is the most likely diagnosis? A cryptococcus B primary CNS. Signal on T2, weighted imaging, which is caused by hemorrhage or free radicals. 45 Answer B, primary CNS lymphoma. Primary lymphoma is the most likely answer because of the position, the hyperdensity on CT, and the necrotic center. Cerebral lymphoma is often hyperdense due to the dense cellularity, although this may not be the case in patients who are immunocompromised. Toxoplasmosis is also a consideration, but these are more often multiple. Herpes encephalitis is an unlikely diagnosis as the patient is relatively well, and the typical imaging features are asymmetric high signal in the frontal and temporal lobes on T2W imaging. E. tuberculosis 46, a 32-year-old had a CT head following a road traffic accident. Note was made of an incidental finding of a low-density lesion in the right cerebellopontine angle. There was no enhancement following for iodinated contrast. On MRI the lesion was low on TI and T2W imaging. 46 Answer A, arachnoid cyst. Arachnoid cysts are common incidental. Bright on T2, weighted images. DWI demonstrated signal similar to CSF in this region, with no apparent incidental findings, which are CSF-filled cystic lesions within the arachnoid space. They are found within the middle fossa, pericellular cisterns, retrocerebellar cisterns, and cerebellopontine angle. They are thin-walled cystic lesions which are CSF density 0 to 20 Hu, and do not enhance with contrast. There is often bone remodeling and compression of the underlying parenchyma. On MR imaging it has the same signal characteristics as CSF on TI, T2, flare, and DWI. They can be complicated by hemorrhage. Epidermoids appear very similar to arachnoid cysts on CT, but on flare and DWI they are bright, and will be brighter than CSF on T1 weighted images. Choroid plexus 47, a 32-year-old male presented with recent onset headaches and seizures. CT showed a rounded extraaxial mass in the interpeduncular cistern with peripheral calcification. Low-density homogeneous foci were also seen within the basal cisterns. No enhancement was visible post-contrast. On MRI the lesion appeared bright on TI and T2 with a low signal rim. On proton density, PD, images it was of homogeneously high signal. What is the most likely diagnosis? (47) Answer A, lipoma. Intracranial lipoma is an uncommon mass accounting for 5% of all intracranial tumors. They commonly present in the callosal cistern but can occur in any cistern. On CT they are well defined, of similar density to fat, -100 Hu, with peripheral calcification and no enhancement. On MRI the signal characteristics are similar to fat, but inhomogeneous on PD. Craniopharyngiomas are usually cellar or supracellar. Arachnoid cysts have the same signal characteristics as CSE. Epidermoids are usually lobulated and off midline. Dermoids are usually more heterogeneous. Craniopharyngioma 48, a 12-year-old male was scanned following visual complaints. An MRI showed a supracellar lesion, which was high signal on TI and T2 weighted images. Multiple areas of low signal were also seen within it, and the dorsum celli was partially eroded. Given the patient's age and radiological features, what is the most likely diagnosis? A lipoma. B. Craniopharyngioma. C. Rax cleft. Cyst. D. Arachnoid cyst. E. Pituitary macroadenoma 49. Lobulated and off midline. Dermoids are usually more heterogeneous. 48 Answer B, craniopharyngioma. Craniopharyngiomas are intracellular or supracellular lesions, and most commonly occur in the first 2 decades of life. They are high signal on T2, and can be either high or low signal on T1, weighted imaging, the low signal areas being due to calcification. Bony destruction occurs in 75% of cases, and also in 75% of cases the mass is principally cystic. Pituitary macroadenoma 49, a 6-year-old boy was investigated for precocious puberty. On sagittal T1, weighted MRI there was a homogeneous 1 cm, well-defined soft tissue mass between the pituitary stalk and the mammillary bodies. The mass did not enhance with contrast. What is the most likely diagnosis? A craniopharyngioma. B. Pituitary adenoma. C. Eosinophilic granuloma. D. Hypothalamic hamartoma. E. Chiasmatic glioma. 49 Answer D, hypothalamic hamartoma. Hypothalamic hamartoma is a tumor of the tuber cinereum. Patients are typically less than 2 years of age and present with precocious puberty and gelastic seizures, spasmodic laughter. They are most commonly seen in the tuber CIN, areum, or mammillary bodies. On CT they present as a round well-defined homogeneous mass with no enhancement. On MRI they tend to be isointense on both TI and T2 weighted imaging. E. Chiasmatic glioma. 50 A 13-year-old boy was being investigated for progressive confusion, lethargy, and increased thirst. CT was performed which demonstrated a well-defined, smooth-walled homogeneous hyperdense lesion in the pineal region. At which other site does this tumor most often occur? A posterior fossa. B. Spinal cord. C. Supracellar cistern. D. Lateral ventricle. E. Frontal lobe. 51 A 35-year-old woman is 3 months postpartum. She had a normal vaginal delivery with an epidural as anesthetic. Since her child's birth she has complained of a postural headache but otherwise feels 50 answer C, suprasellar cistern. This patient has a germinoma, and the second most common site is in the suprasellar region, 20%. Germinomas account for 2% of all pediatric brain tumors and are commonly seen in males aged between 10 and 25 years of age. Patients commonly have Parnot syndrome, paralysis of upward gaze. On CT, there is a well-defined hyperdense mass within the pineal gland, and on MRI it is isointense on TI and low signal on T2 weighted imaging. On both CT and MRI there is bright enhancement with contrast. Feels well and is not depressed. On MRI brain she was noted to have generalized thickening of the dura, which enhanced 1 frontal lobe 51A35-year-old woman is 3 months postpartum. She had a normal vaginal delivery with an epidural as anesthetic. Since her child's birth she has complained of a postural headache but otherwise feels well and is not depressed. On MRI brain she was noted to have generalized thickening of the dura, which enhanced uniformly and small bilateral subdural collections. No parenchymal or bony abnormality was visible, and there was no hydrocephalus. What is the most likely diagnosis? A dural metastasis B and plaque meningioma C intracranial hypertension D meningitis E sarcoid 52A25-year-old woman had an MRI and CT for investigation. #51 answer C, intracranial hypertension. Intracranial hypertension can occur spontaneously, post-operatively, or following a lumbar puncture and presents with postural headaches. On MRI there is dural thickening with uniform enhancement, subdural fluid collections, engorgement of the veins, sagging of the brain, and increased enhancement of the pituitary gland. The likely cause for this patient's postural hemorrhage was an unintended dural puncture during insertion of her epidural. These are often treated by a blood patch injecting the patient's own blood at the level of the puncture to seal the defect. Meningitis and sarcoid can cause diffuse dural thickening with enhancement, but as the patient is well this is unlikely. And plaque meningioma and dura metastasis are unlikely as she is a bit young, and the whole of the dura is affected. Wouter I. Shevink MD, spontaneous spinal cerebrospinal fluid leaks and intracranial. Investigation of headaches. She appeared morphologically normal and had normal blood tests. She was found to have a well-defined mass, which was homogeneously high signal on both TI and T2, weighted MRI in the midline suprasellar region deviating the pituitary posteriorly. On CT there was again a well-defined loosely low-defined mass within the suprasellar region with no enhancement. The rest of the pituitary appeared normal. What is the likely diagnosis? A Raft's cleft cysts B craniopharyngiomas C pituitary adenoma D metastasis. Hypertension. JAMA. 2006, 295, 19 2286 to 96. 52 answer A, Raft's cleft cysts. Raft's cleft cysts are embryological remnants of the Raft's pouch. The cysts are lined by columnar and cuboidal cells and occur in the intracellular region. They are high signal on T2 and can be high or low signal on T1 weighted imaging. Raft's cleft cysts can compress the pituitary gland. They are E hypothalamic glioma 53A40-year-old female was being investigated for a familial movement disorder. On CT of they are usually asymptomatic but may cause hypopituitarism. Treatment is either with cyst aspiration or cystectomy. Of her brain there was caudate atrophy with compensatory enlargement of the frontal horns of the lateral ventricles. How is this condition inherited? A X-linked recessive B X-linked dominant C autosomal dominant D autosomal recessive E not inherited 54A15. 53 answer C, autosomal dominant. This patient has Huntington's disease, which is an autosomal dominantly inherited disease. The age at which symptoms occur is dependent on the length of the trinucleotide CAD repeat sequence. 54 answer C, telangiectasia. 15-year-old girl with a neurocutaneous disorder had an MRI which showed vermion and intrahemispheric atrophy with compensatory enlargement of the nth ventricle. There were also multiple small cortical wedge infarcts. What cutaneous abnormalities is she most likely to have? Ataxic telangiectasia is an autosomal recessive disease, which is characterized by multiple telangiectasia, cerebellar ataxia, pulmonary infections, and immunodeficiency. Brain imaging demonstrates vermion atrophy, cerebral infarcts, and cerebral hemorrhage secondary ruptured telangiectatic vessels. Patients are susceptible to upper respiratory infections and malignancy such lymphoma and leukemia in children. Adults have a very high incidence of breast and bowel cancers. E. adenoma sebaceum 55A22-year-old Australian gap year student started to develop unusual behavior, dystonia, and dysarthria while traveling around Europe. On MRI she was found to have high signal in the caudate and putamen. There were no mass lesions, hydrocephalus, or extra-axial blood. What is the most likely diagnosis? A Wilson's disease B ataxic telangiectasia. 55 Answer A. Wilson's disease. Wilson's disease is an autosomal recessively inherited condition, which results in abnormal ceruloplasmin metabolism. Copper is deposited within the liver, cornea, and brain. Dysarthria, dystonia, and tremors are commonly early clinical findings. On imaging there is atrophy of the caudate lobe and high signal within the outer margin of the putamen, caudate, and lateral aspect of the thalami. High signal is often seen within the pons. Treatment is with a chelating agent. A 39-year-old man had a CT of his head, on which a fat density was seen in the most superior parts of the frontal horns of the lateral ventricles. No other abnormalities were visible. What is the most likely reason for these findings? Findings. A ruptured dermoid, cyst, B intraventricular epidermoid, C germinal teratoma, D intraventricular lipoma, E metastasis 57. King A.D., Walsh J.M., Kendall B., E.T.A.L. Cranial imaging in Wilson's disease. A.M., Rintinol. 1996, 167, 61579-84. 56 Answer A. Ruptured dermoid cyst. Dermoid cysts are usually midline and are well-defined masses with fat, skin, sebaceous glands, and sweat glands. They are fat density on CT and high signal on both TI and T2 weighted imaging. These are prone to rupture, and as the fat molecules are less dense than CSF, they tend to lie in the most superior areas of the ventricles, temporal and frontal horn of the lateral ventricles. E metastasis 57 A 35-year-old woman is being investigated for demyelinating disease. What is the best sequence to demonstrate plagues in the posterior fossa? A axial T2B cornal flare, C axial proton density, D axial flare, E cornal TI 58 A 5-year-old boy was 57 Answer A. Axial T2. Flare and T2 sequences are good at identifying MS plagues. T2 sequences are better at identifying lesions within the spinal cord and posterior fossa. E cornal TI 58 A 5-year-old boy was noted to have multiple well-defined lucent areas with no sclerotic margin and a narrow zone of transition on his skull X-ray. A contrast-enhanced CT was then performed, which demonstrated an enhancing soft tissue mass within the abnormal areas of the skull vault. What is the most likely diagnosis? A dermoid, B metastasis, C encephalocele, D eosinophilic granuloma, E prominent venous lakes 50. Pretorius PM, Quaggabeer G. The role of MRI in the diagnosis of multiple sclerosis. Clin Radiol. 2003, 58, 6/434-48. 58 Answer D. Eosinophilic granuloma. Eosinophilic granuloma is also known as histiocytosis X and Langerhans cell histiocytosis. It results from proliferation of the reticulohistiocytic elements. It is most commonly a monostotic disease, 50-75%, affecting young children 5 to 10 years. The most commonly affected bone is the skull, but lesions can occur in both flat and long bones. In long bones it most commonly occurs in the diaphyseal region. Skull lesions are punched out, well-defined lyric masses most commonly occurring in the parietal and temporal bones. Once treatment has been instigated, a thin sclerotic margin is seen in 50% of cases. On CT, there is often an enhancing soft tissue within the lyric area. E prominent venous lakes 59 A 30-year-old West African woman was being investigated for a right Bell's palsy and diabetes insipidus. She was known to have an abnormal CXR. On MRI she was found to have diffuse meningeal enhancement with some modularity. What would be your next investigation? A repeat CXR. B CT brain, C meningeal biopsy, D staging CT, E full blood count 60 A middle-aged male. 59 Answer C. Meningeal biopsy. This patient has sarcoid, which is most common is females and West Africans, and the most common presentation is with bihilar lymphadenopathy. The CNS is affected in 1 to 8% of patients with sarcoid. The leptomeninges, dura, subarachnoid space, peripheral nerves, and ventricular system are affected, and the most common findings are cranial neuropathies with the facial and acoustic nerves being the most commonly affected. Patients can present with a septic meningitis, fits, and MS-like plagues. On imaging there is diffuse enhancement of the meninges, which is sometimes nodular and is most common in the basal cisterns, but can affect any region. Hydrocephalus may be present and small vessel change can occur. Definitive diagnosis is made by meningeal biopsy, and ACE levels may not be raised. 6. E full blood count 60 A middle-aged male presented with increasing paresthesia in the right leg. An X-ray of his lumbar spine and views of his leg were unremarkable. An MRI was performed which showed a lesion displacing the thecal sac away from the bony spinal canal. Which of the following would you not include in the differential diagnosis? A prolapsed disc, B epidural metastases, C neurofibroma, D ependymoma, E meningioma 61. 60 Answer D. Ependymoma. The lesion described is extradural in location. Extradural masses arise from outside the spinal dura and may originate from the vertebral body, disc, and adjacent soft tissues. On Mr. Dura may be seen draped over the mass, and sometimes epidural fat may be seen capping the lesion. Intradural, extramedullary lesions arise inside the thecal sac, but outside the cord and originate from the nerve roots, meninges, and CSF spaces. On MRI, intradural lesions are clearly delineated by CSF, and the cord is deviated away from the lesion. The subarachnoid space is enlarged up to the mass. Intramedullary masses arise inside the spinal cord and originate from the cord parenchyma or pia. On MRI, there is diffuse enlargement of the cord with gradual effacement of the subarachnoid space. 61. E meningioma 61 A 6-year-old child presented with gait problems and neurologic deficit. An MRI of the brain and whole spine was performed. There was a diffuse abnormality in the upper thoracic cord extending over approximately 5 vertebral levels. The lesion appeared intramedullary in location, and was iso-intense on TI, and hyperintense on T2, weighted images with enhancement on TI following for gadolinium. A syrinx was seen more superiorly. What is the most likely diagnosis? A ependymoma B transverse myelitis C astrocytoma D metastases E hemangioblastoma 62 A26. 61 Answer C, astrocytoma. The commonest intramedullary lesions are astrocytoma and ependymoma. Astrocytomas are the most common cord tumor in children, and the cervical cord is the commonest location followed by the thoracic cord. Multisegmental involvement is common, and they are often associated with a syrinx and cysts. Despite being low grade, they tend to enhance strongly with contrast. Ependymomas are more common in adults and occur in the conus medullaris and phylum terminale. They are generally slow growing and cause vertebral body scalloping. Cysts and hemorrhage are common. 62 Answer E hemangioblastoma 62 A26 year old male with hemophilia developed sudden onset cauda equina syndrome, and an emergency MRI of the lumbar spine was performed. A large fusiform posterior extradural mass extending from L1 to L5 was present. It was hypointense on T2 weighted images. What is the most likely diagnosis? A epidural abscess. B metastasis C arachnoid cyst D neurofibroma E hematoma 63 A70 year old male was seen in outpatients with left T1-2 nerve root pain. 62 Answer E, hematoma. Spinal hematomas occur due to trauma, following a procedure, typically laminectomy or epidurals, during childbirth or spontaneously, particularly in those with bleeding disorders. They are usually due to venous bleeds and are typically posterior fusiform masses. They can result in a cauda equina syndrome and require prompt neurosurgical evacuation. E hematoma 63 A70 year old male was seen in outpatients with left T1-2 nerve root pain. CT demonstrated generalized expansion of the whole of the T1-2 vertebra with coarsening of the trabeculae. On T1 weighted imaging there was effacement of the fat around the left T1-2 nerve root. What is the cause for these symptoms? A fibrous dysplasia B metastatic disease C Paget's disease D hemangioma E Langerhans cell histiocytosis 64 A middle-aged woman had a 3-year history. SCUP P Stonum G spontaneous spinal epidural hematoma during pregnancy case report and review of the literature. B.R.J. Radiol 2004 77 922 881-4. 63 Answer C Paget's disease. Paget's disease is characterized by abnormal and excessive remodeling of bone. The prevalence increases with age and the disease predominates in the axial skeleton. The disease occurs in 3 phases, osteolytic, mixed and osteosclerotic. Spinal involvement is common in the lumbar region, and the vertebrae are enlarged with coarse trabeculae. Nerve entrapment and cord compression can occur. The differentials for a solitary expanded vertebra include GCT and ABC, both of which are lyric, and vertebral hemangiomas, which demonstrate a polka dot appearance with little expansion. 64 Answer B. E. Langerhans cell histiocytosis 64 A middle-aged woman had a 3-year history of change in sensation in her lower legs. On MRI of her whole spine, there was diffuse cord expansion in the thoracic region with cystic areas. The abnormality was iso-intense on TI and hyperintense on T2 with multiple flow voids and peripheral enhancement. Bilateral renal masses were just visible on the edge of the MR images. What is the most likely diagnosis? A renal cyst with astrocytoma B von Hippel-Lindau syndrome with hemangioblastoma and 64 Answer B, von Hippel-Lindau syndrome with hemangioblastoma and renal cell carcinomas. A third of all spinal hemangioblastomas occur in patients with VHL. They are the third most common intramedullary neoplasm. They are usually intramedullary but can be extramedullary 25% and occur most commonly in the cervical 40% and thoracic 50% regions. Patients present with a prolonged history of sensory and motor symptoms. They are highly vascular lesions, which are iso-intense on TI, high signal on T2 with multiple signal voids and bright enhancement with contrast. Low signal from hemosiderin is often seen on T2 star. 65 Answer D, C. 65 Regarding cytornegalovirus, CMV, in human immunodeficiency virus, which of the following statements is correct? A CMV infections are the result of primary infection. B. CMV infections most commonly affect the nervous system. C. It rarely occurs with other. CMV infections can cause a brachial plexus neuropathy. CMV in the AIDS population is usually the result of reactivation. 90% of the general population have prior exposure to CMV, usually in childhood. CMV infection more typically affects the respiratory tract. 15 to 30% of HIV patients have CNS evidence of the virus at postmortem. Brain involvement results in encephalitis. It causes periventricular calcification. 66 A newborn girl was found at birth to have a hairy nevus overlying the sacral region and an imperforate anus. She underwent an ultrasound of her spine. The conus was found to lie at L4 and the phylum terminale measured for millimeters in diameter. What is the most likely diagnosis? 66 Answer B, tethered cord. Tethered cord usually presents in children with bowel and bladder dysfunction and lower limb neurology. It is slightly more common in females. 50% of patients have a hairy patch overlying the lower back. It can be associated with phylum lipoma, imperforate anus, phylum cysts, and diastematomyelia. The main features are low-lying cord and thickened phylum terminale, greater than 2 mm. Patients are treated with a decompressive laminectomy. At birth the corns medullaris should lie at L2/3 and at L1/2 at 3 months. 67 Answer E, flexion extension views of lumbar spine. Pars defect is a fracture through the pars intraarticularis. These are A spinal bifida called a 67A35-year-old female was being investigated for bilateral lower limb neurology. On plain film X-ray she was found to have bilateral pars defect with a 50% spondylolisthesis. MR was performed which did not demonstrate any neuroforminal narrowing or nerve root impingement. What investigation would you suggest was performed next? A axial T2, weighted brain bicornal flare brain. Due either to a stress fracture, congenital or secondary to other condition, for example, tumors, osteomalacia or Paget's disease. Spondylolysis commonly occur at the L5 vertebra. Neurology typically occurs after a degree of spondylolisthesis. If on imaging no nerve root impingement is seen, but the history is typical, this might be because the slip is unstable and so flexion extension films should be performed. 68. Flexion extension views of lumbar spine. 68 and 18-year-old boy was involved in a road traffic accident. He had multiple injuries and 1 month after his accident he still had a right TI nerve root palsy. MRI of the brachial plexus was normal. A further MRI study of his cervicothoracic spine was performed which showed an absent right TI nerve root. No conjoint roots were seen at C7 or T2. There was a small, well-defined area of CSF signal at the right TI neural exit foramina. What is the most likely diagnosis? A lateral myelomeningocele B traumatic nerve root avulsion. 68 Answer B, traumatic nerve root avulsion. 69 A 55-year-old woman was being investigated for right lower limb weakness. On MRI there was a well-defined high-signal cystic area in the right SI lateral recess. There was expansion of the right SI neural canal with bone scalloping. Nerve roots are visualized along the wall of the cyst. What is the most likely diagnosis? A Tarlov cyst B myelomeningocele, C schwannoma of right SI nerve root D pilocytic astrocytoma, E hematoma 70 regarding carotid artery Doppler. What features help differentiate the external carotid artery from the internal carotid? The right TI nerve root has been avulsed. This most commonly occurs. A Tarlov cyst is a perineural cyst arising from the nerve root. They most commonly occur in the sacral region and can cause bone scalloping from pressure effects. It is postulated that there is a ball valve effect so CSF flows into the cyst with arterial pulsations. The spinal nerves may be visualized either in the wall of the cyst or the cyst itself. They occur in 5% of the population and are more common in women. They are usually asymptomatic but may cause symptoms such as bladder and bowel dysfunction or lower motor or sensory abnormalities. 70 Answer E, early. Carotid artery. There are no branches arising from the external carotid artery. B usually larger than the internal carotid artery. C the external carotid artery is orientated posterolaterally towards the mastoid process. D low resistance flow pattern is seen. E early diastolic flow reversal. A 30-year women. They are usually asymptomatic but may cause symptoms such as bladder and bowel dysfunction or lower motor or sensory abnormalities. 70 Answer E, early diastolic flow reversal. 1 Answer C, cementoma.